Hi everyone, I'm Dr. Steph, a chiropractor based in Grand Marais. Welcome to my home office. Today we're going to talk a little bit about the 3 kinds of pain again, and then do a meditation, a guided meditation with a different image this time. There is another video that uses the shrinking image and metaphor, so be sure to check that one out. I always start with a little explanation of the kinds of pain because it's helpful, again, to check in and really make sure that we're dealing with the right kind of pain and to learn a little bit about what exactly is going on. That education is really powerful. But if you want to just skip straight to the meditation, you can totally do that. There are little chapters on this YouTube video, so you can skip right ahead to where that starts. So let's talk about the 3 types of pain. Number 1, productive discomfort. This is maybe when you're getting a massage, some body work from me, something that you're like, oh, that feels so good, that hurts so good, right? This is the kind of pain that ultimately relieves discomfort. It feels better afterwards, or maybe within 24 hours afterwards, it feels good. And the pain usually stops when the pressure stops, right? So if I'm really working on a tight muscle, it's like, oh yeah, that's a little tender, but I know it's getting me closer to being out of pain. So productive discomfort, this is also sometimes when we're working out and we're really struggling to lift those weights so we can feel our heart beating hard. It's not always comfortable, but it can be really productive, really helpful for strengthening those muscles, strengthening the heart muscle. So we're 2 thumbs up on productive discomfort. The second kind of pain is damaging pain. This is pain coming from the body to the brain saying, stop, stop, stop. This is causing us damage. This is hurting our tissues, this is hurting our nerves, our bones, our muscles. This is, causing harm, really causing harm. Hand on the stove, ooh, that's a burn, we don't want that. So this is hand on the stove pain, this is causing harm pain. And it's really great that our body can tell us, I am in harm's way and we need to stop, we need to get out of there. This is too hot, too hard, too sharp, whatever it is. So this is pain worth listening to. Absolutely. Damaging pain, that's not where we want to be. The third kind of pain that's easy to get confused for damaging pain is what I have been calling noisy pain. Our brains are really good at scanning for threat, looking for patterns, and anticipating what might be harmful. So we know not to put our hand on the stove. Sometimes what happens with noisy pain is we think that there's going to be pain or damage when in fact there isn't. So this is sometimes just sort of habituated pain. This is some chronic pain. This is pain when we know damage isn't happening, but we also know that it's not that productive discomfort that's actually helping us get better. It's just noisy pain. And I think about this sometimes like, we've all had cars like this, that check engine light is on, or in my car, it's the oil, change oil light. And I'm like, I've checked the oil, I've looked at it, I know that it's good, I know that it's fine, I change my oil regularly. I know that the oil isn't a problem, but that light is just gonna come on in a car that's 11 years old. So I see the light and I go, yes, I know, I'm watching the odometer, I know when to change the oil, I can check the dipstick. I'm gonna check in and make sure that I'm not actually harming my car. There is a reason for that light, but that light is just stuck on. And sometimes our brains have that too with pain in our body. We just get so used to having pain in that one place because it did start out as a problem, or like it's there, it started as a valid reason. And now that light is just stuck on, but you know that the car is fine. You know that your body isn't being damaged by this pain. So that's the other thing I want to say before really getting into this guided meditation is you need to talk to your care team. Don't just use Dr. Google. Don't just look at YouTube videos. Really make sure you're talking to a person who can be there in person and listen to you and get hands-on. Look at scans, imaging if they need to make sure that the pain that you're experiencing isn't damaging pain, okay? So you need to talk to your healthcare providers. There are all kinds of people you can work with. Find a good one that you trust, that you feel like is a good listener to you, really takes you seriously. Make sure that you aren't in damaging pain. And once you know that what we're working on now, the sensations that I'm gonna have you focus on now aren't damaging pain, then you're good to go. So please consult with a healthcare provider. Don't use this couple-minute lecture as a, oh yeah, I'm all clear. But You probably know if you have damaging pain versus noisy pain, but it's easy to confuse the two, especially when it's new, when it's a new sensation or a new difficulty that you're having. So the way that we're gonna work with noisy pain today is with a containment image. So the first thing you need to do is get into a really comfortable position. You don't have to be in any kind of fancy sitting or lying or anything. Just get into a spot where you know absolutely for sure that you aren't hurting your body, right? So there's no confusion about whether or not this sensation is causing any harm. So maybe that's laying down, maybe that's laying on your belly. There are all kinds of ways to be super comfortable and to feel super safe. Maybe close the door, you're not going to be interrupted. So find that position, that location, that environment of safety. And if you need to pause to sort of get the conditions right, please do that. We'll be here for you. And let yourself be at ease as much as possible. Noticing the safety of your surroundings. Your body is calm and at ease, letting go of everything you can let go of. And there is that noisy pain. It's the thing you just can't seem to let go of. So we're gonna listen to that pain. We're gonna say, okay, I see you, I hear you. I'm a very visual person when I lead these visualizations, but I encourage you to sort of imagine if you had to use a marker, or maybe it's the size of a pen, but if I had to use one of those elementary school Crayola markers, I could color on my body where that noisy pain is. So if you had to color where that pain is showing up on your body, and if it's everywhere, try to be really, really specific as much as you can. It's here, it's there, or maybe just pick one piece at a time. Maybe it's in the arm, the leg, hip, low back, shoulders, right? All kinds of places it could be, but I want you to really visualize. Really listen. If you had to color if you had to use a marker to draw on your body where that pain is showing up, maybe it's deep, deep down. And then you've got that picture, you can see it, you could look at your body. If you opened your eyes right now, you could see, what color marker you used, right where it is. Now, this is kind of the opposite of coloring inside the lines. I want you to draw a line around that area that you colored. Draw a line around it. So find all the edges. Here's where it's noisy, and then here's where it stops. Here's where my body's complaining, but actually past this little margin, it's fine. And you might have to, get up close to really tell where those edges are between okay and not okay. So instead of coloring inside the lines, we're lining the color. And maybe it's a wavy edge, or maybe you can't quite tell, but you're like, it's a spot this big or this big. You can just draw a circle around it, or maybe it looks like a very specific, wild, wonky, psychedelic shape. Great, that's the shape. So we've got our noisy pain. We've got the shape that the pain is making. And now we're gonna build a little bubble, a little teeny, maybe it's a really funky building now, but a little bubble, a little dome over that area. Keep that pain in the bubble. So we've got our noisy pain, we've got the edges. Now we're gonna build that bubble up over it. And if you'd like, you can kind of insulate the bubble a little bit. Put some sound insulation over it. And so if you peek inside that bubble, if you were whatever size being you need to be, a little ant that goes inside the bubble, ooh, it is noisy in there. Noisy little stadium full of noisy little pain friends, yelling, yelling, yelling. And then when you leave the bubble, then it's quiet. There's a quietness in your body because we put all that noisy, noisy pain inside a bubble. It's still there, but we've contained that bubble. So keeping that bubble there, I want you to go for a little walk around your body. Walk around other parts that aren't noisy. Right? There are lots of parts of our body that just feel neutral. They don't even have to feel good. They just feel neutral. Your earlobe is generally a place that often feels pretty neutral. Right? There are all kinds of places we can just tuck in. The clavicles are always pretty calm. My collarbones. My pinky finger doesn't bother me very much, right? I can go visit these other places in my body that are nice and quiet. All that noise is in the bubble. And again, if I want to, I can open a little door, listen to the noisy pain. Yep, I hear you. And we just keep it in the bubble and notice how much of the rest of our body, even if it only feels like a little bit, isn't in the bubble. Maybe you've got a really big bubble. Don't have the bubble cover your whole body, right? Try to keep the bubble somewhat contained. Insulate it with snow or something, you know, that quiet that falls after the first snow. The snow just absorbs the sound. Maybe pack some snow around the bubble. And notice how quiet and calm most or a lot of your body can feel. And keep the bubble around that noisy pain. And the more specifically you can see that bubble, the color, the shape, the texture, what you're using for sound insulation, really focusing on that pain is noisy right there, and there's a place where it stops. It is contained. It isn't going to take over all of my mental space. It isn't taking over my whole body. There's just one place, and it can have its place. We're not even trying to change what's happening inside the bubble. We're just putting the bubble around it. That's what I've got for today. Feel free to return to this bubble technique anytime you like, containing that noisy pain, finding the edge, finding out where it exists and where it stops if you can be specific, or just, I need a bubble this big and I'm gonna put it right on my low back. For me, it's right on my hip, right? Recovering from hip surgery, I've got some noisy pain, so I'm right there in the trenches with you. So I've got a nice bubble on my hip. And I just say, okay, you can exist right there, but nowhere else. We're just gonna keep you right in that bubble. So please come back to this video, use it regularly, share it with your friends if you find it helpful. I'm always up to chat for more techniques, other ways to help with this. There'll be more videos coming soon because I just really believe in knowing the difference between these three kinds of pain and finding ways to work with it. So thanks so much for taking good care of yourself. Remember, bodies are meant to be enjoyed, and I'll see you next time.